Good evening and welcome to tonight's Yukon City Council, Yukon Municipal Authority work session. It's July 6, 2023 at 6 p.m. We are here in the council chambers, which is the Centennial Building at 12 South 5th Street in the great city of Yukon, Oklahoma. Tonight we're going to have a presentation by Pafford EMS regarding their contract renewal. So I'll turn it over to you.
Thank you, Madam Mayor. I would like to introduce Jason Likens. He is with Pafford, and we'll let you all go ahead and make your presentation. I believe we have a PowerPoint.
Great, thank you. So my other colleagues that I have here today is Clay Hobbs, our Chief Operations Officer, and he'll actually be doing the presentation. And Daniel King is your Area Director of Operations.
Thank you so much. We'll go to the PowerPoint. And my name is Clay Hobbs. I am the Chief Operating Officer for Pafford Medical Services and Pafford EMS. And appreciate the opportunity to come before you tonight and to discuss the contract renewal and just kind of the status of where we've been at the last year, give you guys a good update. It's nice to not have to have a mask on and be able to talk to you pretty freely.
Yes.
We were pretty restricted the last time we were here. So in case you had any new members of your council, I just wanted to give just a brief history of Pafford. We took the contract over from Samaritan EMS when we acquired them. It's been about 3 years ago now?
February 2020.
Currently, Pafford operates in 4 states and the U.S. Virgin Islands. We have about 1,800 employees. We operate about 280 ground ambulances, 5 helicopters, 3 fixed-wing aircraft. And we've been your ambulance provider for quite some time now. We believe this is our 7th year with Samaritan and Pafford, and we appreciate the opportunity. Just a little bit about the leadership team that leads Pafford. Jamie Pafford Gresham is our president and CEO. I already introduced myself. Dr. Michael Seymour is our chief medical director. Dr. Randy Heron is our Oklahoma medical director for the Oklahoma City metro area. Jason Likens is our Chief Development Officer. Daniel King is our Area Manager, Director of Operations, and Christy McDaniels is the Assistant Director of Operations. Daniel lives here in Yukon. So. Currently in the city of Yukon, we operate 2 ambulances based at the old fire station, 24 hours a day, 7 days a week. We have dedicated staff and crew members that are dedicated to this station. So the same crew members work here day in and day out, week after week. We've put about $111,000 into the old fire station to renovate it, do some upgrades, including roofing and some pretty major additions to that building. It's going to be a work in progress as we go forward just because of its age, and we have some projects that are ongoing at that location now with our facilities department. One of the changes that we've also had here that's affected your system is OU has opened their micro hospital right here in the Yukon area. So that has increased our number of requests for emergent calls, for transfer, and then routine transport. The call volume and demand analysis provides support for the modification to allow greater flexibility. And what we're asking in our changes is that we are allowed to change the language of the contract that allows us to provide the number of unit hours that are needed to maintain the system. I'm going to talk a little bit about response times here in just a minute, but our ask is to allow us to have that fluid ability that states we'd never ever go below 1 ambulance available in this city, but we want to have that availability that sometimes we may need to go up to 3 ambulances during the day and 2 at night. Just to make sure that we have the call volume response times maintained the way the citizens and the council expects. I'm going to talk a little bit about the expenditures too. Since 2018, many of our expenses have gone up. And I'll talk just a little bit about ambulances. We've gone from ambulances costing us around $110,000 to almost $160,000. Cardiac monitors are almost $10,000 more than they were just 2 years ago. So we've had a significant increase in those costs for durable goods and vehicles. But one of our biggest costs has been supply increases. And some of the medications that 3 years ago we were paying $3 and $4 a dose are now costing us $12 and $14 a dose. And some of those patients, like a cardiac arrest patient or a drug overdose, might take 6, 7, 8 different doses of medication during the course of the call. So significant difference in the cost of those calls. We've had about a 60% increase in the calls in the city, and that includes our posting assignments. And you'll notice we've gone up to 1,479 average responses. And is that in
Q2 of 2023.
Yeah. So 56% of our calls are for priority 1 life-threatening emergencies, 13% are for priority 2 non-life-threatening. Priority 3 are hospital interfacility transfers. That's when a hospital calls us to move a patient, and those are about 16%. About 85% of our responses are combined into those responses between life-threatening emergencies and hospital transfers. The remaining 15% are standbys, in which we assist the fire department or police department standing by for an incident, or we're posting or have a unit posting to help cover the city of Yukon. Our average response time quarter 2 of 2021 to current is 7 minutes and 20 seconds. We have an ambulance on scene in that response time of 7 minutes and 20 seconds. If you look just at the past few months, the response time is actually lower than that, and a little over 6 minutes, 6 minutes, 30 seconds. So we have a very good response time to 911 calls within the city, far lower than what our expectation of 11 minutes is. You'll notice that our average mission time is about 59 minutes. So that's from the time that the call comes into us until we're able to clear the hospital. Takes us about an hour for time on task. So from quarter 1 of 2021, there's been an increase from about 10 responses to 16 responses per day. So we've had an increase in volume. There's also been an increase in the number of times that there were more than 2 simultaneous requests for service, thereby requiring support from mutual aid resources. We've been very fortunate to now have the city of Mustang within our EMS system, Bethany War Acres, the city of El Reno. So all of those ambulances have been able to work together in a regional system to provide mutual aid and support for all the cities. So for instance, if we have 2 calls here in the city of Yukon, the next closest ambulance to that call from a neighboring community comes from within the Pafford system. We don't necessarily have to call outside mutual aid from another ambulance provider. That does also mean that sometimes your ambulance goes to help another city. For instance, if the Bethany War Acres area would have 2 or 3 calls at the same time, Yukon would go help them out. And we are soon going to add a 3rd ambulance to keep up with the demand here. We're in the planning stages of that. So in the documents that we have, what we've really asked is that we can eliminate the number of ambulances that we have to have on in a given time and allow us the fluid ability to move the unit hours to where we need them to cover the ambulance calls and the demand. We're not wanting to take anything away from the city of Yukon. We're not wanting to have any kind of a decrease in the number of resources available. We just want to make sure that we can have the right resources in service and available at the right time to cover the call volume and continue that great response time of 7 minutes or less. We truly believe that eventually we're probably going to need around 60 unit hours a day just for the city of Yukon, just to make sure that we have the same response time. We desire to maintain that cornerstone of response time compliance as it's currently written. So the safeguard in the contract document and the way you would hold us accountable is a response time. And most cities have either one or the other. One, they want a certain number of ambulances available in a 24-hour period or a given time period, or they hold the ambulance provider accountable for a certain response time to calls on average. Some of the language that's in our ambulance membership program as it relates to billing, particularly commercial payers and some of our federal payers, we'd like to change and clean that language up because we have had some changes in different health plans and different regulations that require us to have different languages and have different write-off abilities. So that is one of our asks as well. We also believe that we're going to have some direct changes related to the No Surprises Act. The No Surprises Act is a federal regulation that's already affected air ambulances, and we expect to have some type of No Surprises Act come for ground ambulances to protect consumers on a federal level coming soon. So we just need to make sure that we're prepared for that and don't have to come back to you mid-contract period to change that language. And this is just the specific language. I won't read it, but we've provided that. And it just outlines the discounts that we're going to provide. Talks about co-payments, deductibles, and out-of-pocket expense for the residents. We talked about the different costs that have increased. We've had labor increases of over 35%. Non-durable medical goods, that's in the disposable supplies and medications, 45% increase. Durable medical goods, our defibrillators and devices, ventilators and so forth, about 30%. And our ambulance cost of acquisition's gone up 46%. It's not just here that's affecting it, it's across the country. And we've been in a pretty unique position where we had ordered resources early, so we haven't had as difficult of an effect as some other ambulance providers in the region and in the country. But it's definitely hit us very hard. Our ask is to change the adjustment in the monthly utility fee from $3.65 to $5.65 per water meter per utility. And that's to offset the cost of these increased costs. And I will entertain any questions or comments that you may have.
What's the cost in Mustang?
What did you say?
What
ma'am?
is the cost in Mustang, Bethany, and War Acres per month?
So currently, they're actually experiencing the same level of cost that we have set today, which is $365. But we are working with those communities, and we will be doing presentations to those councils this year to increase that essentially the same amount.
The city of Piedmont pays $7.50 on their water meter, and very similar to your situation. The reason they're more expensive is they have less call volume. And the only time that we have an opportunity to collect any money or any revenue is when we transport a patient to the hospital. So the number of transports per the resources, how we are able to offset and pay our costs, such as payroll and vehicle acquisitions and so forth. The subsidy in the water meters actually picks up the gap in between to make us whole. Obviously, we could not provide the level of service that you have here without that, you guys filling that gap through subsidy.
For the council's consideration also, recently we did participate in a competition in Pauls Valley for their ambulance service. And the winning bid for that service was 2.5 ambulances, was $65,000 per month in subsidy. So these it's not just here, it's across the United States. Ambulance services are having to go back and they're having to increase their rates just to keep up with the rising costs. So.
Yeah, I mean, we're seeing it a lot of places. We've been able to contain our costs just because of sharing resources and operating a regional system. You guys don't sit on an island here. We have additional service areas, that touch you and help keep those costs down because all the ambulances are working in a system to make sure that we can back each other up. We just had another award. I don't want to bore you with any information, but I want to make sure you guys understand that it's just not here, but in Arkansas, just across the state line, a very similar community to yours, they're paying $45,000 a month per ambulance. And that was the low bid in that community. So we're not there yet. I don't anticipate that we'll ever be there here just because we have some different demographics. We have different call volumes. Our transport distances are different. There's a lot of variables that come into play when we have that gap. And that's one of them is, what's the transport distance? What is the payer mix? Who's paying the bills for the fee for service? So those are things that we look at closely.
Can you explain to me, I don't know much about ambulance service. We have 2 ambulances at a time in our city. What does that mean going from 2 ambulances to 60 units? What does that mean?
So an hour is a unit. Mm-hmm. So currently right now you have 48 unit hours in a day. because you have 2 ambulances on for 24 hours. And we believe that we're going to have to move that from 48 hours to 60 hours to continue to maintain the response times that you guys have become accustomed to.
So where would we get that other 12? That would pull in a third ambulance?
We'll
or-
have to have a third vehicle. And,
But it
yeah,
would only be used part-time?
probably 12 hours a day during our peak call volume. We have lots of data. We've been here for 7 years now, so we have really good data about when people call ambulances. And believe it or not, the trends of when people call, days of the week, the time of the day, is very common. So we're able to predict that and know, when's the best 12 hours of a day or 8 hours of a day to put another resource in place. Typically, in a lot of our communities, it's 10 a.m. to 10 p.m. We have very few calls after midnight. People don't generally call the ambulance much after midnight because people are hopefully sleeping.
Any other questions?
Now, how many users do we have in the city? Do you know? Go to the
Doug?
water bill.
The approximate number is about 6,500 subscribers. I can tell you that we have 2,451 opt-outs currently. So that's where that 65 comes from, difference in our roughly 9,100.
So that's 6,500 houses.
I think that's how it's done.
Houses.
It's on a water bill. So
Right, so it'd be
whoever
your
the water
house. So that,
customer is.
yeah, so it could be, 4 people in a house or more. And Oklahoma City is still not using Pafford.
No, we do not serve the city of Oklahoma City. They're still currently served by IMSA. And it hasn't changed much. We're still called every day to try to come help them. And we just can't sacrifice our communities here to bail them out. So that is a regional crisis, and it does affect us when it comes to staffing and costs for staffing and the workforce. It's been extremely challenging. They have a crisis response team here from out of state that's staffing their ambulances, and they're paying very lucrative wages that are absolutely not attainable by us or any other provider in the area. So we're having to be very careful and be very selective in making sure that we keep our employees happy, keep them well paid, keep good benefits and good working equipment to maintain and retain those employees.
Any other questions? Sean, what's our response time for our fire department? What's our average?
I believe it's right around between 3 to 4 minutes. I have to look that up.
Sean, you need to come to the microphone.
Sorry.
I could look that up for you, but I believe
Oh,
it's
that's all right.
between 3 to 4 minutes is our response time.
Okay. Can somebody ask a question
Mhm.
from the audience? Okay.
My name's Mike Burris, 300 East Platte Drive. Do you guys go to level 0 to do transports? Or would you, if you only got one ambulance up at the time, would you say, sorry, we can't do a transport right now?
So what we do is if we have an emergent transfer that has to go, that's one of the great things about being in a regional system is an ambulance will come halfway or come to the edge of the city limits to cover while they're going on that emergent transfer. But we don't ever take all the ambulances out of town for transfers at one time, unless it would be something life-threatening, such as a trauma, a STEMI, a stroke that's acute, that we just have to move immediately. And if we do that, we're bringing an ambulance to post. And that's one of the things that you guys enjoy by being in the regional system. You want to say anything
Yeah,
else?
I would just add to that, just for the gentleman's information, that's actually a state law. So if it's a level 1 trauma, if the doctor categorizes that as a priority 1 patient, in effect, they're experiencing a life-threatening injury or illness, then it is viewed the exact same as a 911 response, and we're obligated to respond to it the same as we would under state law.
But for a non-emergency?
But for non-emergency, we never go to level 0.
Okay. Good.
So like, I had to use your ambulance service to go to Oklahoma City. Do you also bill my insurance? Because my insurance has, so you're getting money from my insurance company too.
We are. So when you look at the cost and, and the high deductible plans and so forth right now, it's very difficult to collect all that money. So where you actually may get what appears to be a high bill from us, the payment from the insurance is
Oh, I
much,
know, yeah.
much less. So you probably are very fortunate having a better plan than a lot of people that, the high deductible plans are definitely one of the biggest issues we're facing across the country in the ambulance industry. Just getting that money collected, because people don't have the money to make the copay or the deductible on a $6, $8, $10, $12, $14,000 deductible plan. So that's where the water meter comes in place. Now, if someone opts out, they're responsible for the full bill. And I like to tell people, if someone in your home uses the ambulance one time in 10 years or 12 years, it's definitely worth paying the monthly water bill or the monthly surcharge to cover that and not have that expense. And it also helps support and fund the ambulance in communities like Yukon. So it's really a win-win situation from getting the service, not having to pay for
Oh,
it.
yeah, I paid $0 for my ambulance ride.
Yes, ma'am. We thank you for not opting out.
No, I would never. I think I'm opted in Oklahoma City's plan too, because I live right across the street from Oklahoma City. And so I've told my husband, if I get sick at Onacue, drag my body across 10th Street over to Yukon side. But I think
We'll
we have,
come get you.
we have the other side too. I mean, I can't imagine opting out because it is such a low amount for something that if you do need, it's quite expensive. Any other questions, concerns? John, do you have anything to add? How's it been working with them?
So we have a really good working relationship with Pafford. I know the guys really enjoy their response times. When we were using IMSA, we were waiting sometimes 20, 30 minutes on an ambulance. And now, they send us compliance reports every month, and I forward those to Tammy and Mitch and Jason, and they're compliant normally around 95% of the time, so it's been really good. Can't think of anything that, I think we work really well together as, both agencies, and, we train together, and it's been good.
Okay. Thank you. Anything else?
I was going to add our athletic trainer at the high school had contacted me to get their number to start setting up for football games this past year. And I reached out to Tammy, and as soon as I got it and forwarded it on, one of y'all had contacted him in the meantime because you had it on your calendar, and he was really impressed with that working relationship that they've already developed there.
Okay. All right. Well, thank you so much for your presentation. We appreciate it, and appreciate you when we need you even more so. So we appreciate all that. So this meeting is adjourned. We'll meet back at 7 o'clock.